Right. Hello, I'm Dr. Mike Dorwart, and this is our most recent edition of the Pain Pod. Just real quick about myself, I'm one of the newer providers here at APC and Center for Pain Management, and I work in the downtown Indianapolis office at One America Tower. I joined about 6 months ago, and it's been a real pleasure so far being able to offer my therapies in this environment. It's been very supportive, and it's a very positive place to work. And one of the reasons, or the main reason it's a positive place to work, is that we get to help patients like Mr. Ryan Nunn, who is joining me today kindly and taking time out of his day to discuss his experience with intrathecal therapy, or what's commonly referred to as a pain pump. A little bit about yourself. Where are you from originally?
Newcastle, Indiana.
Newcastle, Indiana. Where do you live now?
Newcastle, Indiana.
Okay, so you're well traveled.
Yes.
And
well versed.
As far as your early career, I mean, what kind of work do you do? Or?
Motorsports and helping third party, just data management.
Well, let's talk a little bit about you and your journey as it is with pain. When did you first begin to have difficulty with your pain? And if you would explain to the folks watching.
Okay, I can start from the beginning, actually. So I was 19, and I worked at a grocery center, and I fell off like a 20-foot scaffolding. And woke up in Methodist and 3 days later, not knowing where I was at.
Mm-hmm.
And that has just prolonged as I've gotten older.
What was the injury you suffered at the time?
They thought I had a head damage, but it didn't help. But I had neck damage.
Okay. Was there a frank fracture there, or was it a herniated disc or something?
A disc, and they just started multiplying over time.
You started having further degeneration,
right? And it just kept going and going all the way down my back.
And at what point would you say, after you recovered from the injury and then your disease progressed? I mean, at what age or how many years after the injury would you say that your pain became rather debilitating for you?
Oh, probably about 20 years later, when I started, having my own house and being the man of the house, doing everyday things that you couldn't do.
Give me an example of that.
Like mowing the grass. I haven't mowed the grass in 3 years, and now I can do it without a problem. Just hop on it and go with not a thought.
What other sort of limitations did you have prior to this recent therapy?
I couldn't get laundry out of the washer. I had no upper body strength, and nothing was responding.
Okay. And how long would you say that you were kind of limited to that degree before we were able to help you recently?
Oh, it was good. 5-7 years.
Okay. And what sort of impact does that have on your life other than the sort of obvious physical limitations? But I mean, oftentimes pain extends into emotional, family relationships. Tell me how it affected you in that fashion.
Oh boy, it made our home life really tough. Well, your upper body doesn't respond. So you're like, well, what am I supposed to do? Like, if I can't live nothing, what am I supposed to do? That is the main thing. If you extremities don't work, what are you going to do?
Yes, I would imagine that could be very difficult.
And then that takes a toll on your wife or girlfriend or whoever you're involved with, and it's just hard to deal with all around, family and all. I mean, you're irritable and all kinds of things.
I think that's a very common and shared experience amongst pain patients, and something that it takes a lot of patience. It does take its toll, and I've actually seen, unfortunately, many relationships suffer, marriages break apart, things like that, with chronic pain patients whose family members couldn't take it anymore, And so it's a very common phenomenon, is all I'm trying to say. And did you ever have any emotional changes, depression, anxiety related to your
of course, I suffer from that anyway. Mm-hmm. So just added to that, it just quadrupled and made it worse, adding on. Mm-hmm. My wife could see a change in me. She's like, wow, you're doing stuff. And I'm like, you feel better and you're talking, you're not isolating yourself. And
let's talk about what other treatments you had over the years for your pain. I'd love to hear how it started out, what kind of doctors you saw. I don't need to know names or anything,
sure.
But what was done.
I had all kinds of epidurals. I can't even tell you how many. That would be, the medical record sheet would be unreal.
And presumably for a while they provided some benefit for you.
For, short relief. It wasn't a long-term process because that's not a long-term process.
Right.
Oral medication, I don't like to live on a time regime, so that didn't work. I mean, it worked, yes, but, it just wasn't beneficial to me.
It would wear off.
It would wear off.
So I think one of the things that we emphasize is that, you in long-term pain management, and most pain management providers follow this sort of practice, is you want to utilize everything at your disposal within reason rather than just one modality such as narcotics or opioid medications. And oftentimes those sort of options include injections, which can be very beneficial. The problem with long-term pain management and injections, it's not that we can't utilize them effectively, but that if it's a chronic condition related to your spine, for example, oftentimes over the course of time, the effects of those injections will wear off, not last very long, and it becomes difficult for the patient to maintain a schedule where you're getting these injections 3 or 4 times a year, where insurance is playing a role in whether or not those get approved. And so it can become frustrating, but also it's just not consistent and what I refer to as a durable therapy. And that same is true of opioids at times. The narcotics that can be used appropriately for the right patients in the right conditions, but even when used appropriately at reasonable doses, you have pitfalls with them, right? Did you have any side effects from your opioid medications that you could identify? Some people do, some people don't.
They were mild. Irritability was probably one of them.
Mm-hmm.
I'll be real quick to lash out.
Mm-hmm.
Now, with the pain pump, I'm not quick to lash out.
Do you feel that was a result of the actual pain medication, or do you feel it's the better pain relief you're experiencing?
The better pain relief by miles.
Did you ever have anyone in your life express concern over your use of pain medication? I forget how much you were on. I don't think it was a huge dose.
No, it wasn't huge, but it was 4 times a day, so it was pretty potent stuff. Right, there was no way out, at that point.
Right.
And it was pretty rough.
And let me ask you this. Prior to coming to Center for Pain Management, had you ever heard of a pain pump or heard of that option as a treatment?
I have through different people and things. And then we really started to research it, and on our own, then we talked to you, and you helped guided me through it. And you said that pamphlet said it all, 85% recovery rate, dude. But you're not going to be able to do everything you can do in a day. You have to realize that. It takes time. If you're laid up or down, you have to work yourself up. You cannot run out of the gate like a sprinting racehorse. You'll hurt yourself more.
I think that's an excellent point to bring up, Ryan. I mean, one of the things that I try and instill in my patients, you didn't get to where you were overnight. Your spine took years to degenerate to the point where your pain became very difficult to control and was limiting your function. And because of that, over time, you lose your ability to function appropriately, just like anybody, even if you don't have chronic pain and you're overweight, you fall into a condition where your body can't do what it once was able to do. And it takes a while to get that back. So if you have an intervention such as a pain pump implanted, or really anything, your functional gains will lag behind the sort of therapy in terms of a dose increase, for example, or introducing the therapy for the first time. You need to realize your body's still not going to quite do what you want it to right away. I know oftentimes early on with pumps, patients have fairly dramatic results. So tell me about what you've experienced so far.
You have to let your body get used to it before you just start, introducing it to life again. Because it is traumatic to your body. Because it goes right to your body, And it's just outrageous when it's done.
I think one of the things we should talk about is perhaps a little bit about how a pain pump works, because I know some of the folks watching this have probably heard about pain pumps before and how they've worked. If you've watched these episodes before, you probably are familiar. However, if you haven't watched these episodes before, a pain pump is what we refer to as intrathecal therapy, or spinally delivered pain medication. And specific, we're usually talking about narcotic or opioid pain medication. And the reason we choose to deliver the medicine to the spinal fluid is that opioids act at the level of the spinal cord. The opioid receptors that are most significantly involved in pain transmission are at the level of the spinal cord, and they block the transmission of the pain signal from one nerve to the other. So when you take an oral medication or an intravenous medication, those work in the same way to control your pain, but the problem is it's not as efficient a delivery system. It can still work, don't get me wrong, but with the intrathecal therapy or targeted drug delivery, that medication, every drop of it is going where it needs to go in a low dose, but a high potency formulation. And because your other tissues, as we've talked about, aren't exposed to that drug in high quantity, like your brain or your gut, you don't have the side effects usually, such as drowsiness, cognitive dysfunction, nausea, constipation. Most of the time, those side effects go away. Now, that doesn't mean that intrathecal therapy is perfect. Doesn't mean you can't get side effects. And we can even talk about your early experience when what was the first drug we put in your mouth?
Morphine.
And what were the side effects you were experiencing from morphine?
I had bad headaches, and it had me down.
Mm-hmm.
It was rough. I mean, I was nauseated. I felt like my eyes were spinning, and it was pretty bad. When I'd come in here, I'd be like, I'm, not well, we need to do something. And he did something immediately, and now we're on the right foot and we're going.
Because we put a different drug in your pump, which is now hydromorphone or Dilaudid.
Dilaudid,
yeah,
yes.
So it's a synonymous drug there. So like any therapy, you can have side effects from it, but, typically you end up somewhere with a well-tolerated medication. You had exquisite sensitivity to morphine, unfortunately, but now we know that. And we do know that you're tolerating hydromorphone. Your side effects went away rather immediately when we switched the drug.
Correct.
And this is just part of the process with the pump. You kind of have to trust the process. Most of the time the first drug works, but once in a while it doesn't. Unfortunately, Ryan was very willing to switch over to a different drug. Now, since we got on the right path with the hydromorphone or Dilaudid, tell me how your function has improved. Give some specific examples if you could.
Oh boy, life is so different. I wanted to get out. On sunny days, I would lay in the bed. Now I'm up, wanting to get out of the house and do something. I want to be productive, like set a short-term goal. Well, today I want to do this or accomplish A, B, and C. And I go for it. Like, I want to achieve stuff now. Now, it's going to take time, depending where you're at in your pain. When you get one of these, you're going to have to give it time, like the doctor spoke of. You're going to have to give it time. It's not a sprint, like you told me.
Yes, and I think that's a really great message to send to anybody who might be a candidate for intrathecal therapy, is that we expect it to work, but don't expect it to work 100% overnight. And as long as you have the appropriate outlook, and that comes from counseling from the doctor, that should be imparted to you, as part of our job. But you've exhibited very good understanding of what to expect. I know one of the tasks you mentioned was mowing your lawn. You had not been able to do that in quite some time. And I know the last time I saw you in clinic, you told me that you had done it. I don't know are you still able to do that?
Oh yeah, I'm ready to do it today,
Yeah.
I'm like, when are we going to be done? No.
Yeah.
I have to accomplish
Now,
something.
how big of a lawn do you have?
Oh, it's about 1.5 acres.
And is it a push mower you're using?
No.
Or a rider? But even riding a mower was difficult.
Oh yeah, because the bumps in the yard my spine would vibrate.
Uh-huh.
Like even going down the road, if it was bumpy, you know how sensitive I am. It would just, my spine would just bounce, and it just made it really bad.
I think one of the things that is so hard for other people to understand, this includes myself, I don't have chronic pain, but it's very hard to imagine how something seemingly so relatively benign like that, a car ride or a lawnmower, can be significantly bothersome to somebody. And you think, come on. But I hear this over and over and over again. You're not the only one. I hear it with patients with back pain, neck pain, abdominal pain even. That even simple stuff like car rides and lawn tractors, whatever it is far more bothersome than you would think it could be. In the short term, you've already doubled your, activity tolerance.
Right.
What about walking or prolonged standing? Any of that?
Oh yeah, that was terrible.
Uh-huh.
When I go to our local basketball games, I would have to get a certain padded chair. They'd have one for me when I'd go in, and I couldn't go if I didn't have it. I was on a cane for I don't know how many years. Matter of fact, I met my wife and I was on a cane 16 years ago. So how attractive is that?
Now, how about, I know a lot of times patients will tell me that family members, friends will comment on how they appear now versus before they got the pump. Have you heard any of that at all?
Yes, I have my cousin, as a matter of fact. She goes, he's a whole new person. Because my grandpa is elderly and he lives on a big forest area. And I had to get something out of the garage and it was hanging. And she's like, she went in and told my wife, she's like, Ryan was hanging from the rafters in the barn. I had to get his spreader down. So she's like, Ryan was up in the barn. What was he doing? Well, was he on his feet? Not fall. I go, yeah. And she goes, I never seen him do that before. Like his motivation is so high.
Yeah, and your frankly, your ability to function is much better already. So that's really great to hear. Of course, as your doctor, I have to say, be careful when you do that
well,
stuff.
Sure, yeah.
But I'm glad to hear that your functional improvements have been significant so far. Don't know where to really go next in terms of your story. We're very early in the journey. What do you anticipate in the future? What are you hopeful for? Is there anything you're hoping the pump will do for you that it's not doing right now?
In a way, yes. It's just minimal. Just kind of maybe increase the dose a little bit, which I think would help at this point. I mean, I don't know where we're at because I don't have my bolus meter out to just be like going, hey, guys,
Right.
And that's another beneficial thing, which we'll talk about that later, I'm sure.
Sure. Well, one of the sort of typical course that pump patients take is, again, they get sort of immediate improvement from the initial start of the therapy. You hope that that's not the peak. I always tell patients that, again, it'll be a slow process, but, we're not going to get you back to totally normal 18-year-old body,
Right.
For lack of a better, running marathons.
Yeah,
okay.
like tomorrow.
Right. But usually the functional improvement is significant and well worth having the device implanted in the right patient. So I think, over time, you can expect to see continued improvements to a certain degree. There will be a point where you plateau. And it's very important for patients to understand that. And I think you get that.
Right.
And I think that that's an important part about anyone who's getting a pump, is to understand that every therapy has its limits. But this one's pretty good, and I pumps are the most rewarding therapy I offer. And that is hands down, no questions asked. There's no therapy I do with a higher long-term success rate. It is my favorite clinic visit that I do in a year, or whatever you want to say, is the first visit after a patient has had a pump implanted. I love seeing those patients come back. Most of the time, you were a little bit of an exception, but most of the time they're telling, but even you were endorsing some pain relief. You were just having side effects. I had a guy come in this week who was nearly pain-free from his chronic abdominal pain on a tiny dose of pain medicine in the pump. And he has some other abdominal pain, but he was nearly pain-free already. So that was a real home run with that one. But it is rewarding. Patients reduce their dependence on oral medicine, usually eliminate it. You're not on oral narcotic anymore, correct?
That is correct.
And, their quality of life is improving, and the trajectory is certainly going the right way. Do you have any questions about the future of the therapy for you, or any concerns, or anything you just want to tell people about it?
Well, you have to trust what you're hearing from your doctor. You've probably been in pain for a long time, and this could be your last resort. This was my last resort. When I came into his office the first time, I said, man, I'm desperate. I've got to have something. I said, nurse, I want a pain pump. She came in with the pamphlet, told the doctor, here's what we got to do. We'll start the introductory process. You'll have to go A, B, and C. Okay, no problem. Do you want to get better? Do you want a better quality of life? He can help you do it. I mean, I'm a prime example of that. You just have to follow the path given to you.
I think something you just said brought up a good point. You mentioned that you were kind of the less common patient that came in ready to go with a pump. I mean, you had heard about it, you had looked at it, you wanted one. Fortunately, you were a candidate for one. Some people, most people come in either maybe having heard of a pump or not having heard of pumps. And they are very maybe uncomfortable with the idea at first because it's an implanted device. And I think every human being on the planet can relate to the notion of not really loving that idea of having an implantable device in, like a pacemaker or an artificial joint or a pain pump. It does require a surgery to do, and it's adding some foreign body to your body, and that's sort of a uncomfortable notion. So most patients, I would say, kind of have to get comfortable with the idea, and that's okay. That's what we're here for, is to help you get comfortable with the idea. One of the things I don't want to be is a salesman, okay? And that, by which I mean I don't want to pressure someone into it. I don't want to sell them on it. I want to educate them about it, tell them what I think it can do for them, and let them make a choice about it, because that's when the buy-in really comes, is when a patient goes, okay, we all know we're taking a chance or a bit of a risk here. We all know you're going to do something that's outside your comfort zone, but look where it's gotten you now. And so my job is to identify the patient, to educate them, and to make sure they understand the therapy. You don't have to be completely sold or 100% comfortable with it. You just have to come listen and think about it, and make sure that the doctor thinks you're a good candidate for it. But give it a chance, give it some thought. And again, you were kind of an exception. You were ready to go, but that's okay too. Unfortunately, I have some patients come in wanting a pump and are ready to go, and they're not candidates for it. That's hard too. So, do you feel your body's accommodating to the object at this point?
Yeah, it's, I would say after the healing process, I would say it gradually stops. And once that stops, it's all go. After the healing part, it's all go. And everybody is different, so each process is going to be different.
Yeah, I completely agree with that. I mean, one of the things we learn early in medical school, but you really learn once you start practicing, is that every patient truly is different. There are no two patients identical, truth. And I, have very, very few patients who I can compare to one another. But, the management can be nuanced to every patient and molded to them. So usually you're able to have success, again, with patients who are chosen appropriately for the pump and selected appropriately, I guess is the way to say it. So I'm really glad to hear you've had this early success. One thing we might want to do with this podcast is check in a couple of years and see where you stand. And we could even, interview you again if you're interested in it at that time, and see how your life is then compared to now, and you'll have more perspective at that time. You'll be going, I hope anyway.
Right.
You'll be able to look back. Yeah. Right. I mean, we'll see where your journey is at that point in time with your pain, and maybe be able to reflect on how your life has changed for the better, or hopefully for the better, or if there are some negatives you'd like to share with people. Without putting your wife on the spot, since she's sitting right next to us, and making her be on camera or anything like that, has she said anything to you about how you've changed since it's been implanted, or has it been more of a discussion between you?
I've done a lot more talking than I was opposed to. I'm pretty laid back now, more casual.
Okay. Relaxed.
Right, more relaxed is the right term, yes.
Yeah, I think, a lot of the times you get so used to being one way over time, and you don't even realize how your pain's affecting you. I had a short stint personally where I had a pinched nerve and a lot of pain in my leg, and though I didn't realize that, my wife was telling me that I was a little more agitated than normal. So it's kind of nuts how that combination, or that correlation between your pain and your mood is very real. And it exists. And one thing to realize is that it's not just your pain making your mood worse. Your mood can make your pain worse. And so
for sure.
It's important to make sure both of those things are attended to. That's a theme we could go off on for a while. But I mostly this initial foray into podcasting for me, I wanted to talk to someone who's had a good experience early on with a pump, and let people know that this therapy for the right patient is a wonderful thing. I really appreciate your time. And your willingness to share your experience with any potential viewers and listeners. And hopefully through that shared experience, we'll be able to offer this therapy to more people, because it is dramatically underutilized. It is not offered by every pain physician, which sickens me to some degree, because
I agree with that.
It just frustrates me, I guess is the way to say it, rather than sickens me. I just think the right patient, this should be offered to more people. And I offer it to anyone I can. And it's really again, the most rewarding thing I do. And really the reason I do what I do is the pain pumps. And, I enjoy doing all of it, but the pumps are really the heart and soul of it. So without further ado, I don't want to take any more of your time. If you'd like to say anything else, you please go ahead and do so.
If you listen to Dr. Dorwart, you're going to go places. And anybody in his system, follow what they had to say. Just go with the flow. That's all go with the flow, be patient, and work the process.
I certainly appreciate that, Ryan. And of course, anyone that comes in for consultation will, take the time to talk to them about that process and the device. And of course, whether that person is a candidate for one or not. So, again, thanks for your time. I think we can kind of wrap this up, with respect to the Ryan's conversation. And hopefully we'll do another one of these down the road. Maybe you'll be involved. And for anyone who is interested in any sort of pain treatment, but especially if you're interested in a pain pump, please visit the American Pain Consortium website or Center for Pain Management, Indianapolis. You can see information about the different doctors who practice in our group. And I think you'll find the website very helpful. Thank you for joining us.